So we're joined by Sarah Smith. Sarah is part of the team at B&W Equine Vets, which is a large dedicated equine practice in the Southwest. And Sarah, I believe you've got 4 clinics, so quite a sizable operation. And Sarah is going to join us tonight to talk about the fight against disease, antimicrobial stewardship, and antibiotic resistance. Which is something that probably a lot of horse owners aren't that aware of. So we're glad to have you, Sarah, to shed some light on it. Sarah, do you want to just give us a brief introduction about yourself and how you got into veterinary medicine?
Sure. Thank you for having me, Winnie. I got into veterinary medicine, I think, like so many people, because I loved animals and in particular horses when I was young. I did quite a lot of riding when I was young. Then I went to university in Cambridge and I have been an equine vet ever since. And gradually over time, I've got more and more specialized. And these days I do just internal medicine, and I work in the hospital at B&W, seeing a mixture of sick horses and horses with elective medicine problems as well.
Great. So let's crack on. And I suppose the best place to start is just to ask the basic question of what are antimicrobials?
So antimicrobials covers a whole group of compounds. The thing people probably most commonly associate with this name is antibiotics. So those are drugs that act against bacteria. But there's also antivirals, antifungals, and antiparasitics. Certainly originally these would all have been naturally occurring compounds, but obviously over time the ability to make these drugs in labs has developed as well.
So why are they important to us as horse owners and obviously then you as veterinarians?
This group of compounds are really fundamental in our ability to prevent and to treat disease. Yeah, the most common would be antibiotics. This is the one everyone knows about, and these are used to treat bacterial infections. And that's really crucial. Things like pneumonia, horses with septic joints, although they might need surgery, we really rely on antibiotics as well to help clear up infection in those horses. Horses that have colic surgery, they are given preventative antibiotics. It covers a real spectrum, but they really are very fundamental to veterinary medicine. The other drug in this, or group of drugs in this, when we're talking about antimicrobials, would be antiparasitic medication. They're used to prevent and to treat parasites in horses. The most common of these being worms in the guts. And again, they're really crucial to our ability to look after our horses. Less commonly do we use the antivirals and antifungals in our equine patients, but as the name suggests, they're used against viruses and fungi as well. Over the last 100 years, certainly since antibiotics became available, these medicines really have become crucial to keeping our horses healthy and to curing them if they develop infection. Everything from ringworm to joint sepsis to diarrhea caused by redworm. So much of what we as vets treat rely on these drugs. If we were to find these drugs were becoming less effective, we would be less well able to look after our horses and less well able to treat them if they were ill.
I think a number of us are familiar with the sort of term antibiotic resistance because obviously it happens in humans, and I think we all know that sort of doctors are less likely to give out antibiotics these days because of it. So tell us a bit about what it exactly is and how prevalent, how we're getting to that stage with horses. Is it something we should be really concerned about?
So yeah, as you said, it's something that we all know about from human medicine. Antibiotic resistance happens when there's a bacteria that's able to survive antibiotic treatment. So if you can imagine, if a horse is infected with 100 bacteria and you give antibiotics, if one of those bacteria actually has a gene that helps it to survive the antibiotic treatment, the other 99 are killed off, that one bacteria survives, but then it's able to replicate and then it makes an infection that's resistant to treatment. So that's over time, with more and more use of antibiotics, gradually we are selecting for this population of bacteria which are resistant to the drugs. And those bacteria that are surviving are the ones that are causing the problems. And yes, it is a problem in horses. It's not as widespread and as big a problem as it is in people, but it is, people have, groups around the world have been doing really nice research to show that it is an increasing problem and it certainly is present in equine populations.
And what are the consequences ultimately for us in our equine population as the antibiotic resistance develops?
The first and most obvious consequence is that the patient that you're looking at the time, or your horse, won't get better, that they might need longer treatment, the treatment might be more expensive, or it might be more complicated, or the very worst case scenario is that they don't get better at all because they've got a bacterial infection that vets don't no longer have armory to treat. But that's quite a narrow viewpoint. Actually, probably really more importantly for all of us, the real concern is that that horse that develops those resistant bacteria can pass them on, and they can pass them on to other horses, but also to people and to pets like dogs. So these bacteria, they're not unique to horses or unique to people. They can spread back and forward between everyone. And we know studies have shown that it's possible for these resistant bacteria to transfer between mammals. So then the resistant bacteria can spread, and obviously the problem has the potential to get bigger and bigger. If we look at an example of this, a really well-known example, I think that everyone will have heard of, is MRSA. The name is methicillin-resistant Staphylococcus aureus, but the name is a bit misleading because it's not just resistant to one antibiotic. It's resistant to a whole panel, loads of antibiotics, most of the ones we would use commonly. This MRSA has been causing widespread problems in human hospitals for years. Because the bacteria are resistant to most antibiotics, it's really hard to treat infection with MRSA. But what people are probably less well aware of is that MRSA infection has been reported in horses and in livestock. And we know that the MRSA bacteria can pass between horses and humans. So-called human strains have been found in horses and in people in close contact with those horses. And we know that the people in close contact with horses, the horses and the people, are likely to carry the same strains. So yeah, as I've said, these drug-resistant bacteria can pass backwards and forwards between humans, horses, other mammals. I guess, although I used MRSA as an example, actually in horses, there are probably other antibiotic-resistant bacteria which are more common and possibly more important, particularly horses with their big hindgut fermentation, and also the fact that they poo on the floor of their stable and then potentially lie in it. The gut bacteria that they carry are really important, and they can become resistant to antibiotics. And then again, there's this potential for it to spread between horses and then further afield into other mammals and to humans.
And what's the importance of the antibiotic resistance as it develops? What's the concern that we should all have?
Well, the very worst case scenario is that one day we don't have the drugs we would like to be able to resolve bacterial infection. And the same would be true for parasitic infection. This would have a real massive impact for veterinary medicine and for all our patients. It would be like we'd gone back to the 19th century. The consequences would also be really widespread for veterinary medicine and the treatment of horses, but also for human medicine, livestock farming, and even food production. It's a really massive issue and one we all need to play our part in preventing. But alongside that, and maybe a less sort of worldview type look at it, would also be a very practical look at the fact that if we don't take care of our antimicrobial use, if we're not seen to be being responsible, there is the possibility actually that we will have that responsibility forced on us by external regulators. Understandably, the government and the bodies around the world that regulate human medicine and use of antimicrobials are watching what's going on quite carefully. And if it was seen that we weren't acting responsibly, it's possible that those rules might be put in for us. There are other parts of Europe, for example, where antimicrobial use is much more strictly regulated than it is here. And if that was to happen to us, or if certain antimicrobials were to be restricted as just for use in humans, that would make our roles as vets more tricky and would have real quite significant impact in our ability to treat horses. So I think you can look at it either way. You can either take the viewpoint of wanting to do the right thing for the world, or the viewpoint of, if we don't do the right thing, someone will make that decision for us. But either way round, it's certainly very important that we take this matter seriously and act on it.
And what is that part that we can play? Sort of like me as an ordinary horse owner, you in the veterinary trade, what are the things that we can really do to help reduce that development of the antibiotic resistance?
I worry that this is a bit of a bandwagon that we're always harping on about. And I think certainly my colleagues would probably at this point start rolling their eyes because it is something that we see as really important and therefore that we put a huge emphasis on. Everyone has a role to play in this. Horse owners, anyone looking after horses have a big role to play in supporting their vets. Every vet out there is trying to reduce antimicrobial prescribing in the same way that doctors are trying to reduce their prescribing. That doesn't for a second mean that if a horse has an infection that needs antibiotics, anyone would hesitate to give them. It simply means that I think we've moved a long way. There was probably a historical point of view where if there was any doubt a horse might have an infection, you would give antibiotics. We've moved quite a long way these days towards the viewpoint being, do you really think there's an infection? And if you really think there's an infection, give antibiotics, but don't give them just in case. So to get us down that path, what we really need to do, it's a question of trying to reduce the risk of infection occurring so that we don't need them, testing to choose the right medication, and then using them for the right length of time. So to answer your question about how can you help with this, number one, good biosecurity. So I think some of the other talks this week have talked a lot about biosecurity and hygiene and preventing the spread of disease and therefore the need for using antimicrobials. Number two, if you think there's a problem, get your vet involved early. Catching these things early almost always means less treatment, and you might need less complicated antibiotics or less advanced treatment. Number three, and I think this is something that we don't probably address often enough, is allow your vet to take samples from your horse to test what the bacterial infection is and then choose the most appropriate antibiotics. This is a step in the process that people quite often want to skip because obviously it's cost and sometimes it might be seen as unnecessary cost, but actually if you can choose the right drug targeted for the infection rather than choosing the drugs blind, generally you're going to have a better outcome for the horse. You might get a quicker outcome because you've done the right thing early on. But also when we're talking about this sort of bigger picture view in terms of doing the right thing for the world, that certainly is the case. Number four, take your vet's advice about whether antibiotics are needed and how long for. Thoughts have really changed these days. There's no such thing as a course of antibiotics for a set length of time. It's about treating until the infection is resolved, but not longer than that. And under this banner probably comes the discussion of if you've got some sachets of antibiotics on the shelf from a different horse, really try to resist the temptation to just give them without consulting your vet. Have a discussion with your vet, try and go through those steps we talked about already, rather than just giving a little bit to see if they get better. And the last thing would be to really practice good hygiene, both from the point of view of trying to stop any kind of infections spreading between horses or from a horse to yourself, but also actually if you end up giving your horse antibiotics, try not to get them on your hands or try not to inhale the powder, because obviously at that point you give yourself a little dose of the antibiotic, which helps to perpetuate this resistance problem.
That's really interesting, and I think probably a number of us don't necessarily think of it from that way. So I suppose it's like you say, this whole week, a lot of it boils down to really good biosecurity and hygiene measures at home, because that's ultimately what a lot of this boils down to. Sarah, this has been brilliant. I just one final question, I suppose, and it puts you on the spot a little bit, but how do you feel optimistic about sort of our attempts to reduce this antibiotic resistance? If we all play our part, have we got a future with using antibiotics regularly and them being able to treat disease?
Yes, I think so. I really hope so. I think over time we've already seen actually that people and vets are doing a really good job of reducing their antibiotic use. There's some quite nice studies that have been looking at this, and we are making progress. And there's definitely organizations that are developing specifically with this goal in mind. And we are making progress over time. So I feel very optimistic. And yes, I think we just all have to do our very best and keep going.
Well, Sarah, thank you for that insight into antimicrobials and this buildup of resistance. Sounds like we all have a part to play, which I think is pretty much sort of across the board in the health of our equines. So thank you for your time and thank you for your insight.
Thank you. You're very welcome.